Welcome to today's Smart Round. SMA will be hosting these each month on a different topic, chosen by our members and our faculty. My name is Randy Glick. I'm the Executive Director of Southern Medical Association. I'll be serving as your host today. During this 1-hour webinar, SMA Education Committee member Rodney Overstreet will discuss compassion, fatigue, burnout, PTSD, explain depersonalization and derealization, and detail the process of interoception. He will also highlight healing tools and modalities that can be utilized to target the pain, release it, and allow space for healing. You're encouraged to post chat questions and raise your hand using the Zoom toolbar. Reactions, I think, is what you click on. We will look for good times to break in during the presentation to engage in more organic conversations. So Rodney, I'll hand it over to you.
All right. Thank you so much, Randy. I appreciate you and everybody else that's helped me be here. And first and foremost, I just want to say that I'm so thankful and grateful that SMA sees the importance of this issue and this topic. And on my shirt, you can see Heal Our Healers. This is the support group that we run on Facebook. And you can go to www.healourhealers.org to learn more about us. But I started Heal Our Healers in September of 2020 because I had noticed that there was a problem amongst my peers. I had 3 really close friends go to rehab for abusing various drugs. And unfortunately, 2 of my close friends and mentors, one took her life with propofol and the other took his life with alcohol ultimately. And so I was seeing a rise in self-destructive behavior amongst my peers. I had physician colleagues who were having issues and troubles over the years. The rates of divorce were kind of rampant. People were angry and frustrated and just not in a good place in their caregiving positions. And I just couldn't really figure out what was going on. So I started doing some research and digging. And that's when I came across a PDF from the Green Cross, which is the American Society for Traumatology. And Dr. Figley is the man who coined the term compassion fatigue. And so I finally could put a language to what was going on. And then I came across this gentleman, Tim Hansel. And Tim Hansel was a mountaineer and an alpine skier and an avid outdoorsman. And he unfortunately fell in a crevasse and broke and ruptured several of his discs and broke his back. And so for the rest of his life, he had chronic pain for about 35 years, severe chronic pain. And this quote is fantastic. He said, "Pain is inevitable, but misery is optional. We cannot avoid pain, but we can avoid joy." We cannot avoid pain, but we can avoid joy. And I think that's very important to understand because in caregiving and helping professions, it's a form of chronic pain because every day that we go to work, we're engaging with people who are suffering and hurting, and that suffering and hurting rubs off on us in a very psychological, emotional, and spiritual way. And if you want to read more about Tim Hansel, he wrote a book called You Got to Keep Dancing, and I just love that idea. And so as I began to read this PDF from the Green Cross and Dr. Figley, I began to understand that what nurses described in World War I as shell shock ultimately became post-traumatic stress disorder as we began to evaluate veterans from Vietnam. And then once I started understanding PTSD a little bit, I began to see those effects in some of my colleagues from some of the difficult situations that they had come in contact with. And also started to see those things in myself. I certainly had compassion fatigue. And so then I began to try to develop my vocabulary so I would have a fluency. And so if we're going to understand clinical suffering, if we're going to understand why aren't we in the place that we want to be as far as the healer that we want to be and the provider that we want to be, then we've got to have a language to articulate these ills, this suffering. And so that's where we begin to describe the situation. The way I like to think about it is, if you've ever seen that movie Predator with Arnold Schwarzenegger in the 80s, or they've redone it several times, The predator has a cloaking device, and he can cloak himself. But if you know kind of how to look for the predator, you can see a subtle shift in the background of the jungle as he's moving through the jungle. And so these spiritual and psychological um, dysfunctions or ills are constantly attacking us, but they're hidden. But once you begin to learn the language for clinical suffering, you begin to be able to pick out the sort of the background and see this thing happening, this thing attacking you. And this has been moving among us for generations. And medical school and nursing school has taught us how to heal other people, but it didn't do a really good job of teaching us how to heal ourselves. And so that's ultimately why I started our support group, to teach people the language of suffering, to articulate their own ills, and so that they could see these things, this hidden spiritual attacker that was in our midst. And so then I started to look at things like trauma, and trauma can be a big T or a little t. And big T trauma is typically something that, and trauma also comes from the Greek word wound. So you can think of trauma as a wound. It may not be a physical wound, but it's an emotional wound. It's a spiritual wound that affects us. And little T's don't typically impact our health and well-being. They're not something that's going to hurt our body or harm our body. It might just be a harsh word from somebody, or it could be a negative email, or it could be a difficult conversation with a colleague. But little T's can add up, and over time, little T's can have just as much impact as a big T. And a big T might be losing a patient. A big T might be losing a job. A big T might be getting in a car accident, or getting a cancer diagnosis, or some other thing like that, where it actually is threatening our own physical well-being. And big T's can also come with post-traumatic stress disorder. And I don't really like that term either, because whenever you're faced with a big T, it's not a disorder, right? If we are traumatized, let's say if we're a victim of violence or rape, then that's a post-traumatic stress response. And so I think a much healthier way for us, and a better way for us to destigmatize PTSD, is calling it PTSR. It's a post-traumatic stress response. And clinically speaking, PTSR or PTSD has some criteria that distinguish it. And usually it's a trigger. So if I had a patient that I was caring for, and they coded or had a big pulmonary embolism, and they had a big wound, and we were using peppermint oil to mask that smell in the ICU. Every time I come across peppermint smell, I might be brought right back to that moment in time. And it acts like a bungee cord that kind of pulls you back into the trauma. And when you have that trigger, you relive that experience again. So it's almost like you're back in that ICU room. And maybe you as a physician have been managing that patient for a month, or even several months, trying to get them better and heal them. And maybe you've developed a relationship with that person, and even got to be friends with that person. And so when you witness their demise, it's incredibly shocking and traumatizing. That's definitely a big T. And so then you might also experience another one of the symptoms of PTSR or PTSD. You might want to avoid going into the unit. So maybe, if you're if it was a certain room, might not go in that room, because that room has a very strong impact on your soul and your spirit and your emotions. Or you might relive that moment over and over again. You might have nightmares. You might not be able to sleep. These are all keystone elements of PTSD or clinically acquired PTSR. You may even begin to not feel anything. You may numb out as a way to help yourself not experience those feelings. And so I've had friends who, I had a brother who was at the hospital at St. Vincent's years ago when there was an active shooter, and he was just about 5 feet away from the policeman and the house supervisor and the X-ray and the telemetry tech that got shot. And so I had to see him struggle with PTSD for a number of years as he got better. And I've certainly had those issues in my career. And so I began to see that as one of the issues that we face: the big T's, the little T's. Acute stress is like what I'm doing right now. Giving a speech is an acute stress. A chronic stress is kind of a long-term thing, like being in a bad job or being in a bad marriage. A small stress is like having a bad argument with your wife. But if you're in a bad marriage, that's a chronic stressor. And as we all know, life is complex and difficult, and we all have chronic stressors, whether that's a difficult child, or maybe that's your parents who are living with you and because they're older and infirm. And so those are other issues that pile up on top of us. Other issues are like moral injuries. And so being in the healthcare profession, we're constantly called to do things that may be against some of our core beliefs and values and ethics. And that could be something like putting a peg tube in a patient who is not really salvageable. And in your heart and soul, you don't feel like it's the right thing to do, but the family insists on putting that peg tube in. And in that core belief, there's a line that's being crossed there that you don't feel comfortable with, but you are obligated to care for the patient. Or it could be, helping with an abortion or an ectopic pregnancy, and maybe you have issues with that. And so that's moral injury. And compassion fatigue is the thing that we all have problems with, because anytime that you care for anyone, you begin to empty out your own cup, your own reservoir of empathy and care. And compassion fatigue is just the cost of caring. I heard one lady talk about it's like wading through a water and not getting wet. And what's very interesting is if you're caring for your children at home, then you're already being depleted. If you're caring for an elderly parent, or if you're caring for a special needs brother or sister or child, you're already being depleted. If you're caring for a sick animal, if you have a diabetic cat, believe it or not, you're at risk already just going to work. And then we go to work and we're caring for patients who are suffering all day, every day, and we get further depleted and further depleted. And if we're not aware of these, go ahead, please.
Yeah, I was going to say I went through something similar the past couple of years with a grandmother and then a father that was going through some similar situation. And something that really worked out cool was I got a video camera, and just turned it on and just talked to them about their life and their history and growing up. And it was a way for me to really connect with them in a deeper way that I hadn't over the entire years of our lives. At the same time, they went on and on and on forever. It was
Perfect.
amazing what they could recall. And it just sort of turned a bad situation into a good one. So it was like something I actually enjoyed spending hours in some cases with them at a time where you feel like you're having to really stress, and you're taking care of them, and you're visiting them, you're seeing, they're cleaning up after them, things like that. But this was just
Yeah.
sort of something that really worked well.
Yeah, that's a great way to reframe what could be a burden into a gift and a way of connecting with that elderly person. That's brilliant. And so that's one of the techniques that we utilize whenever we're trying to address our own suffering, is cognitive reframing. Um, but compassion fatigue is cumulative. It's insidious. You don't really see it happening. They don't really talk about it or teach us about compassion fatigue. And if we don't engage in activities to help mitigate compassion fatigue, then it will build up, and over time, we will be completely depleted. And one of my mantras in Heal Our Healers is, you cannot pour from an empty cup. And so we've got to keep refilling our cup, and that's where our toolbox comes in later. Burnout is another problem that's rampant in our institutions, and burnout is more institutional. It's whenever you don't really feel like you're making a difference anymore. You just feel like you're a cog in the machine. You don't feel like you have any power in the political system or the bureaucracy. And ultimately, burnout is affected by compassion fatigue. It's affected by moral injury. It's affected by PTSD or PTSR, and it can lead to an individual fleeing the institution, or even ultimately fleeing the field of caregiving and helping and healing. And we definitely don't need that, because we're already in a shortage of these caregivers. Your work is incredibly important, and we need you in caregiving and helping and first responder positions. And so that's another reason that I started this support group, is to keep and maintain our caregivers and providers by enabling them with tools. Because unfortunately, no one's going to come save us. No, there's not going to be a first responder, an emotional first responder, that's going to bust into our house and make us eat healthier, or go work out, or sleep, or do these other things that we need to do, or debrief to them and say, hey, tell me what's going on in your soul, and tell me why you're so sad. So we have to take some radical responsibility for that. But to keep talking, there's another thing that I identified later on, and that's existential dread or existential apathy. And I actually saw this when I was in high school. I had a girlfriend whose mother was a nurse, a beautiful lady in her 40s, at the time. And one day she just started smoking. And I was like, what are you doing? And she goes, well, she said, I've always wanted to smoke. And I had a lady the other day who was like 70 and she was beautiful porcelain skin. She had this huge stroke and now she's all vegetable and she can't do anything. So what's the point? I'm just going to smoke. And I couldn't figure that out. I was like, what's going on with this lady? But she was burnt out. She was a victim of compassion fatigue and she had this existential dread, this existential apathy because she kept seeing patients get old and frail. And as we know, no one's going to win this game. Like we're all going to die. And so she was a victim of existential dread or existential apathy. Nothing mattered anymore. So she might as well just do whatever self-destructive thing that she wanted. And recently, there was a first responder here in town who was on a motorcycle and he had a motorcycle crash and ended up expiring. And I'm not saying that it's the case, but maybe he was going a little fast. Maybe he was just trying to blow off some steam. Maybe he was, suffering from some of those things too. I've certainly had friends who engaged in risky behaviors because they have that existential dread, that existential apathy. And then those existential ideas can lead to nihilism. And nihilism is where nothing has value, nothing has meaning. What does it matter? We're all going to die. Everything's falling apart. And those people are at risk for suicidal ideation and self-harm. And so we desperately need to identify or help individuals identify those feelings inside of themselves so that they can seek help and engage in behaviors to bring them back to their healthy, homeostatic caregiving home. And that's what we're going to talk about next. We see so much vicarious trauma. We see so many people who are hurt, injured. ER nurses and trauma surgeons constantly are dealing with people who have catastrophic injuries, and that takes a toll. And as nurses, bedside nurses, and hospitalists, we're constantly being told stories that are terrible of neglect and families that are dysfunctional and chronic pain. And that takes a toll on an individual. You take that home with you and you internalize those stories, and those stories hurt you and harm you because you are an empathetic individual. And at a certain time, at a certain point, you can't take any more. And when you can't take any more, you begin to disassociate. And that disassociation can lead to emotional numbing. That emotional numbing can lead to a gap in your caregiving. So we're an empathetic, loving, caring, kind person who was attending to every patient, but suddenly you can't do that anymore because you've just been so wounded. And so then you're a little bit cold, a little bit callous to protect yourself. And then you begin to feel guilt and shame because you're not the caregiver that you were. No fault of your own. You've just been injured and you haven't been told that you were injured and you haven't been shown how to bring yourself back to healthy homeostasis. And so then that guilt and shame makes you go into a spiral. And so you can see how these things mount up over time. And so the goal is to educate our caregiving body with this language to give them fluency. And then the next important thing is for us to learn how to check in with ourselves. And that's another thing that we're not taught. We're not taught how to attend to ourselves. We're taught how to attend to a patient. I'm taught how to provide immediacy with you guys. I look at you in the eyes. Maybe I sit on the edge of your bed. I give you direct contact. Maybe I put my hand on your leg as we speak to show you that I care about you. I shake your hand. I call you by your name. And so I provide lots of immediacy to you and I attend to you, but I very, very seldom attend to myself. And so something that's really important, and one of the most important things, is providing immediacy to ourselves. And so when we're having a hard day, when we have a difficult moment, like if I have a patient who I cannot intubate and I cannot ventilate and I'm scared to death and I'm super in my sympathetic nervous system, but we finally get things established. Let's say, I finally get it, or a colleague comes in to help me in another set of hands, and we finally establish that airway and the patient's okay, that I take a moment either in the operating room once things are settled, or take a break, go to the restroom somewhere quiet and private, where I can actually attend to myself, where I take a deep breath. I notice my body, and I begin to interocept. So we have five senses we know of. We have our sight, our hearing, our smell, our taste, and our touch. But we also have equilibrium and proprioception. Proprioception is where our body is in space. But there's another one that isn't very commonly talked about, and that's interoception. And interoception is just our ability to check in with ourselves and see, most commonly, is my bladder full? Do I need to go poop? Am I in pain? Do I need to shift so I don't get a bed sore? If I'm watching Netflix on the weekend or whatever, when I'm finally decompressing. But there's other parts of interoception that are really important too, like, am I sad? Am I angry? I'm just not in a good mood right now, but why am I not in a good mood? And I just take a moment to look at myself and say, oh, well, maybe it's because I'm still scared or frustrated about, that thing that happened this week. Or maybe I'm still sad about that conversation I had with my colleague where, they were upset that, I did do this or I didn't do this thing. And so interoception is really important. And it's just noticing our bodies and asking ourselves, how do we feel? And so the first thing I'd like to do, go ahead, please.
Yeah, I was going to say, I'm sort of thinking about these things from my own perspective. It seems like a lot of nowadays, when you have that moment of time to do that, you gravitate right to the death scroll of social media.
Yeah.
So it's almost like we filled that time for that with this thing that draws us in, that's very addictive. So is there any kind of thoughts about interventions on stuff? Like, it's almost like when you go to look at your screen, stop,
Yeah,
turn all the media off.
you called it out perfectly, and if you can call yourself out on that, because that's a form of numbing, and so there's lots of different ways that we numb ourselves out, and that we can numb ourselves out with distractions, like scrolling. We can numb ourselves out by drinking or using drugs, or gambling, or pornography, or there's tons of different things that we can do to distract ourselves from attending to ourselves. And our egos are always trying to protect us. Our egos aren't, our I, me, my isn't a bad thing. It's a very good thing, but it's constantly trying to protect us. And it will even try to protect us from ourselves by telling us everything's okay, everything's fine. I just need to, have another drink, or I just need to, watch another movie, or I just need to play those video games, or whatever it is to keep my mind busy. But I'm going to teach you guys next how to interocept. So with your permission, I'm going to ask you to, number one, just play along. And number two, I'm going to ask you to take your inner critic and just put your inner critic in the back room for a minute and let it read a book or whatever. I'm going to ask you to and just engage in this activity and have some fun with it. So the first thing I want you to do is just gently close your eyes, and I want you to notice your breath. Don't control anything, just notice your breath occurring. Notice it coming in, notice it going out. It just comes and it goes, and you don't have to control it. You can control it, but you don't have to. Now, the next thing I want you to think is, I want you to think of your favorite metaphor. We're going to do a body scan from the top of our head all the way down to our toes. And your body scan can be like an old-fashioned printer, or a typewriter, or an apple peeler, how it goes round and round and round, or it can be a waterfall where it cascades over your body. It doesn't matter. I want you to start at the top of your body, and I want you to look for any tension in your scalp. And let your attention go to your ears. Look for any tension there. If there is, relax it. Any tension in the back of your neck, if there is, relax it. Any tension in the jaw, if there is, relax it. If there's any tension in the tongue, I want you to actually drop the tongue from the roof of your mouth. Peel it away, because when we get nervous, anxious, afraid, sad, we stick our tongue to the top of our mouth. So peel it away. Let it lie softly in the bottom of the mouth. Any tightness in the neck. If there's tightness in the neck, to relax the neck muscles. Let the shoulders sag all the way down. Feel the chest, the air move in and out freely. Let the shoulder blades fall down and back. If you want to shrug your shoulders and relax, just to remember what it feels like to relax, you can do that. Feel your shoulders relaxing, your biceps, your elbows, your arms, all the way out your fingers. Let the relaxation just pour all the way down your body. Now we're going to check in our chest, around our heart. We're going to check in our lungs. Is there any tightness there? Or between our shoulder blades? In our belly, is our belly tight or is our belly loose? Relax it, let it go. In our hips, lower back, we carry a lot of tension there. We're just looking for tension. If you find any tension at all, just allow that to relax. Breathe into it. Your buttocks, your legs, your calves, your feet. Good job. That was a physical. Keep your eyes just relaxed. Keep breathing. So that was our physical body that we just looked at. We're going to do one more time. And this time we're going to look at our mental body, or our emotional body. And we're going to just start at the top of your head again and just start working your way down. And if you've got a knot behind your ear where you've been like really clamping and holding tight pressure, just breathe into it and relax it. If you've had a lot on your mind, just acknowledge that you've had a lot on your mind, or that you've been upset, or you've been afraid, or you've been there's been tons of deadlines, and just see those wherever they reside inside of your mind. Maybe they're in front of your mind, maybe in the back of your mind, and just breathe love and peace and relaxation into that, and let those just sort of just fade away or start sinking down. Maybe you had a lump in your throat because of money problems or any kind of issues. Just swallow that, let it go sink on down. Maybe you've had some worries on your shoulders, some things that have been working on you. Let those just fall on down your shoulders into your chest. Now we're down into the chest. I want you to feel your chest opening wide. Maybe you've had something that's been going on today and you just feel like you can't breathe, like there's just too much happening, too much coming at you. I want you to breathe deep. Maybe you've dropped down into your belly now and you've got something that's been working on your tummy or your belly, your stomach. It's got your stomach upset. You've had a gut feeling about something. Let that all sink on down, all the way down to your hips. Let everything sink on down to your legs, all the way down to your feet. And once all that stuff's in your feet, just think about little spigots on your toes and open those spigots up and let all that stuff just drain right out of your body. Take a big, deep breath. Allow your body to be smooth and soft. If there's anywhere that's been tight, let it loosen up and relax. If there's anything left inside of there, now's a good time just to look at it and give it love and give it peace and talk to it and tell it you're safe inside of your body. I love my body. And good job. Fantastic. So you can do that, and it only takes 2 or 3 minutes, and you can do it while you're doing your work. As you're doing your work, you can do that, but you can do it in a quiet place if you need a quiet place. It gets easier the more you work on it, but you'll find during the day that you're clenching your teeth, your jaw. You'll find that the tongue is stuck to the roof of your mouth and it's bone dry. You'll find that your shoulders are up, around your earlobes, and you'll start softening those. And as you begin to do these things, your emotions will begin to change and your inner landscape will begin to change. You literally will change your neurohormonal environment by doing small things. There was a study where researchers had students put a pencil in their mouth and between their teeth. And just by doing that, not asking them to feel happy, not asking them to smile, not asking them to engage in any other activities, their sense of well-being increased, their cortisol levels dropped, and their saliva, just by putting a pencil in your mouth and moving those muscles in your mouth. And so our body will fall in line. If we act a certain way, if we release certain things, your serotonin, your dopamine, your oxytocin will begin to fall in line, and you will literally change your internal environment. I call it getting high off your own supply. Just very simple things. Just relaxing your body will change your neurohormonal state. Anybody got any questions about that?
Yeah, we could open it up. Does anybody want to comment or ask any questions at this point? It's probably a good point to good time to see if any of our participants want to post a question or say something. This is a interactive time, so if you would just either post something in the chat or click on the reactions in the bottom and raise your hand. Anybody? While we're kind of giving everyone some time to maybe do that,
Yeah.
I'll kind of just say is there a it seems like sometimes we can't always see these things in ourselves. It's almost like if you had someone that was working with you, a team member, and said, "Hey, let's go sit aside here for a few minutes and just go through that exercise."
Yeah.
That, identifying these things. I know you're going to talk probably a little more about that, but just it seems like it'd be really beneficial to have someone that can help you identify. Yeah.
Yeah. So I'm hoping by opening up these conversations and having these dialogues and monologues and teaching people these tools, that we'll be able to identify our colleagues when our colleagues are in crisis and say, "Hey, I know you just had a near miss with hemorrhage and surgery, or a patient that needed a chest tube in the unit because maybe you were the one putting in the central line. You accidentally stuck the lung. The patient decompensated, had to put a chest tube in. The patient's doing okay now, but you feel some shame, some anxiety over that problem that occurred, which is just, it's going to happen. If you put in enough central lines, you're going to stick somebody's lung. If you do enough surgery, you're going to hit an artery. If you read x-rays, you're going to misread an x-ray at some point. If you're passing drugs all day, every day, at some point, you're going to make a medication error. If someone tells you that they didn't do that, they're not being honest, because we're human beings. And that makes this job really hard, because we're very hard on ourselves. And we really, we can't afford to make mistakes, because our quality output is somebody's life. It's a mother, a father, a child. And that's another reason this job is so dang hard, because whenever there is a problem, it's a big problem. And so checking in with yourself and taking these little breaks, and providing immediacy to that wounded part of you, will ultimately reap great benefits, because automatically you can see that wound, you acknowledge that wound feels seen, so it doesn't hide in a back closet, it doesn't become suppressed. And if it's not suppressed, then it won't fester. A lot of the problems with people who have chronic issues are they've just been pushing things down, pushing things down, and at some point you overload the basement. The basement can't hold anymore, and everything that's suppressed will become expressed. Everything that we repress will become manifest in time. So we have to deal with those things, and there's no better time to deal with it than in that moment. And maybe you don't resolve it completely, but you say, hey, I see the shame, I see the anxiety, I see the fear, I see the anger, that thing happened, and I'm really sad that thing happened. But I also acknowledge that I'm doing the best that I can, and that I'm trying my best, and that I'm going to learn from this, and I'm going to try to do better. And so ultimately, that immediately kind of gets us off the hook, and then we can start processing those things and moving forward. If we don't, then we start to risk things like depersonalization and derealization. And so when we are victims of compassion fatigue, and we give and give and give and give and give, and we don't refill our cup, or when we continue to internalize our traumas and just smush them down and smush them down and smush them down, at some point our ego, our bodies can't take anymore. And so you can become a victim of depersonalization. Depersonalization is a situation, and about 50 to 70% of people will experience depersonalization in their lives at one point or another. And it feels like when you're out of body, like when you're dreaming, when you're almost seeing yourself in third person. Your body doesn't look real. You can look at yourself in the mirror sometimes and not even feel like you're looking at yourself, or your arms look too long or too big, or your legs look too short, or your feet look too big. You can move around the world and you feel clumsy or awkward because you're so disassociated from your body, because you're so traumatized, and you're trying to sort of flee from yourself because there's so much trauma that's happening to you. Then depersonalization is very closely associated with derealization. Derealization is like you're watching a movie, like your life is not even your life. And like you people that I'm talking to aren't even real people. You're like, you hear people talk about video games, non-player characters, NPCs. You begin to see people as not really people anymore. You don't acknowledge their individuality. They're just like pawns or players in a game. And whenever you have this experience, you can have time dilation, where time feels really, really long, or everything feels really, really sped up. And so depersonalization and derealization can be extremely disorienting, and they can cause somebody who's already experiencing some mental illness because of compassion fatigue, burnout, PTSD, PTSR, to become even more anxious and more upset, because life begins to feel not real. And you can begin to see how these things start to add up. And then you might want to flee the situation, either by quitting medicine altogether because you just can't take it anymore, or using substance use disorder because you're trying to self-soothe in some way, or using some other bad behavior, negative behavior, or even ultimately self-harm because you're so ashamed of where you've gotten. And so, as serious as it is, it's fixable.
Yeah. So, there's probably a lot of pressure too to not take that time. I mean, if you feel like, I don't know, just it seems like the tendency would be to not do those things, like you said, sort of suppress it, but because the system needs, you need to see the next person, you need to, it's like dwelling on these things that you shouldn't dwell on. But I guess, taking the time to, uh, and not feeling guilty about taking the time to do these things, because taking care of yourself, I mean, there's sort of an issue with, you know, you keep pushing it down. That seems like that'd be something that would be a really tough thing for people to, to make time to say no, when to say no to things, and when to make sure you're taking care of it yourself.
Yeah, again, you hit the nail right on the head, Randy, because of production pressure in our hospitals, in our clinics, in our surgery centers. It doesn't afford us a lot of time to check in. And when we do check in and we realize that we're really in a crisis, to talk to anyone that we're in crisis and admit that we're in crisis, and then begin to engage in some sort of activity to move us out of crisis back into dysfunction, but functional dysfunction. And so if you find yourself depersonalizing a little bit or derealizing a little bit, and it doesn't always have to be like super detrimental. It could just be like, I don't really feel like I'm connected to my body right now, and that kind of feels scary. It's not like I can't take care of my patients, and it's not like I can't engage with my team. I just don't feel like myself right now. There's a really simple technique to fix that, and it's just called grounding. It's the 3-2-1 technique. I use it all the time because, unfortunately, I suffer of depersonalization and derealization. There are times when I just don't feel in my body. I'm also a big daydreamer, and that's one of my issues. I just get lost in my thoughts. But there's also been periods in my life when I was incredibly stressed, and I was a victim of compassion fatigue and burnout and PTSD, where life didn't feel real either. And the 3-2-1 technique is super simple. You just choose 3 things that you can see, because there's so many things in our visual field. And so I'm watching the sun go down through the forest right now in my wife's office. So I would look at the sunlight coming through the leaves. I would look at the computer screen, and I would look at this nail polish that my wife has on the desk. So that's 3 things that I can see, 3 different things. So immediately I'm engaging my frontal lobe. I'm using the processor of my frontal lobe. So I'm pulling myself back into my body. I'm pulling myself back behind my eyes. And then I want to find 2 things that I can touch. And so since I picked this up, I'm going to feel the raised letters on the bottle. So I can feel those raised letters on the bottle. So I'm engaging my sensory cortex in my brain now. So I'm pulling myself further into my brain, back into my brain. I'm also going to feel the fabric of my shirt. So I'm feeling the cotton of my shirt, and I can feel how soft and fuzzy it is. So that's 3 things I can see, 2 things that I can touch, and then 1 thing that I can smell or taste. So if you're drinking coffee, have a sip of your coffee, a Diet Coke. If you're wearing a scented lotion or anything, or you can smell that. A lot of times I wear this copper bracelet, and copper has a smell. And so I'll just smell my copper bracelet, and it smells like a penny or whatever. Whatever copper smells like, it smells like that. And so I utilize this technique from time to time whenever I'm just kind of feeling floaty and spaced out because I'm stressed out or my brain just works that way. And the 3-2-1 technique immediately engages the parts of your brain that are responsible for sensory, and that pulls you kind of back behind your eyes. So please feel free to play with that, use that, or ask questions about it. Unfortunately, when we are traumatized, it blunts our ability to interocept. So the more we get down this spiral, the more difficult it gets to get yourself out of the spiral, which is why it's so important for us to build fluency, so we understand whenever we're being insulted by big T's, little t's, chronic stress and anxiety, prolonged stress and anxiety. Why it's really important for us to come home in the afternoons and refill our cup with whatever modalities that we refill our cup, so that we are loving, caring, compassionate caregivers. It's never too late. No matter how far you are down the drain, you can always climb your way back up, but it gets a little more challenging because once we are traumatized and we begin to numb out, it's really hard to interocept when you're numb. It's hard to check in when you've numbed everything out because you're depersonalizing and derealizing. We're fleeing from ourselves because being inside of ourselves is so painful because we've got all these insults that have stacked up on us. And so that's why we divert medicines. That's why we engage in risky activities. That's why we self-harm, is because we're trying to flee from ourselves. So our bodies can become very muted and quiet and become difficult for us to talk to and for them to talk back to us. Or the opposite can occur. The world just seems to be coming at you at 1,000 miles an hour, and there's just too much. There's too much noise. There's too much traffic. There's too much data coming at you, and you're just overwhelmed. You can't take it anymore. And so it's really hard to check in when you're being assaulted by the noise. So it's really important for us to, in that situation, find a really quiet place, like a bathroom or our car when we get off work or before we go into work in the morning, and just shut everything down, turn our phone down, have absolutely no stimulation, and then we can check in. And hopefully, then that we'll find enough signal from our actual body that the noise won't drown that signal out. We can actually attend to ourselves and see ourselves and see any of our issues, anxieties, fears, and that sort of stuff. We begin to put up protective boundaries inside of ourselves whenever we're in this critical phase. And so it can be hard to climb over those boundaries, climb under those boundaries, push through those boundaries. It can actually be hard to trust ourselves. We don't even begin to trust ourselves and trust our minds because our mind's playing tricks on us. I find myself if I find myself not feeling like I'm in my body, I might not begin to trust myself because I'm depersonalizing and derealizing. Then you're like, am I going crazy? What's wrong with me? You're not crazy. You're not broken. You're just, you just got to work on some stuff. You're wounded. You got trauma. Trauma is the wound. Any questions about that? Please feel free.
Rodney, I was going to ask you, in your experience, do you find men have a more difficult time self-soothing than women, or the opposite? Because my family were mostly women.
Yeah.
But when we attend, let's say something really sad like a funeral, it's the men that cry, and we're the stronger ones. But yet in other moments, the men in our family are stronger, and it's harder for us to self-soothe. Have you found a pattern, or is it very random?
It seems that women are better at community. So women are better at seeking out other women for support, and that can be book clubs, that can be um, going out for tea or lunch or whatever, and they actually will lean on each other. Men tend to be kind of lone wolves, and we don't use community very well. And community is a huge aspect of that healing toolbox. But anyone can be overly stoic, and I also want to say that, like Brene Brown says, that vulnerability is a superpower. Being vulnerable is one of the most courageous things that you can do. Telling your spouse that you feel overwhelmed or you had a really bad day and asking their permission to debrief a little bit. And you don't have to use any dirty details. You don't have to give any of the blood and guts or the gore. You can just say, hey, I was really sad today because this happened. Or I got really angry because this happened. And just articulating those emotions begin to help those emotions process themselves and move out of your body and begin to heal. They're not locked up anymore. It's kind of the metaphor I like to use, because this is all metaphorical, is that you have this closed door inside of you, and when you open that door up, two things can happen. And let's say that you've got this smoldering emotion inside of you, and you throw that door open, and the light will pour in. And if there's something that's like, gross and greasy and slimy that's been working on you, the light acts as like an a disinfectant, and it kills that thing, it helps that thing die. Or if you've got a smoldering ember inside of you and you throw open the door and you give it oxygen, it's going to catch fire. And so maybe as you begin to articulate those emotions of anger or frustration, you end up, getting more angry or more effusive about that emotion. But eventually, by giving it oxygen, it will burn itself out. That fuel doesn't last forever. No storm lasts forever. But that thing would have stayed smoldering inside of you if you didn't open up that door and you didn't talk to that other person. And that other person might really give you a different point of view. They might give you a really important piece of information that helps you understand it and helps you metabolize that trauma. Or just the love and support that they give you and say, that must have been really hard. I'm so sorry that happened to you. But it sounds like you did a really great job. Can help you metabolize that trauma and that pain. That's a good question.
So um, institutionally, is there a strategy that you see anyone implementing where they're encouraging caregivers, care providers to connect? So that, so that there's sort of some support for doing this. Because I can tell you, at least from the home office staff at SMA, that we really want to make sure that you guys are taking care of yourself. And we understand sort of the psychology behind what caregivers see and do and what they experience and the type of people they are. So I guess it would be encouraging for me to know that there was a bigger strategy or an institutional strategy, or at least within maybe a unit or something, where people were kind of taking advantage of some of these principles. Anything like that?
Another great question. And the answer to that is I have created a curriculum that teaches exactly what I'm talking about. And I had graduated my first RN from that curriculum, and her name is Amy Hubbard, and I call it Medicare, META care. It's self-referential. It's healers for the healers, caregivers for the caregivers. And these people will act as counselors. They'll act as institutional leads. They will act as people to teach and engage in low impact debriefing inside the units, inside the clinics, inside the physician groups whenever negative outcomes occur. They'll lead health and wellness activities like yoga, meditation, breath work. So this is, in addition to my support group that I started, this taught me that we needed a person from within. So we need physicians from within physician groups. We need nurses from within ICUs. We need nurses from the floors who rise up, who care about compassion fatigue, burnout, PTSD, and we need to get them engaged in a formalized education. And I'm in conversations with 2 universities right now about creating a formal degree for Medicare. Initially, it will be a Medicare module for students, and then it will become a Medicare practitioner certification. And ultimately, I want to create a new branch of nursing called Medicare nurse practitioners, who will be responsible for testing the caregiving body and seeing what their levels of compassion fatigue, burnout, and PTSD are, and then implementing strategies to assess and address that, and then testing them later to see how those have resolved, and then engaging with the C-suite. So the C-suite understands that certain units or floors are having issues, and they'll also engage with individuals and be liaisons between individuals, whether it be physician, nurse practitioner, PT, pharmacy, and people who are in crisis. And they'll help those people in crisis find the right caregiver to make them better, whether that's a psychiatrist, a psychologist, a clergy member, because it's trauma affects us all differently, and we all need different ways to work our way out of trauma. Sometimes it is a psychiatrist and medication, but sometimes it's a massage therapist, or it's a Reiki therapist, or it's an acupuncturist, or it's a preacher, or it's an imam, or it's a rabbi, or it's a AA group or an NA group. And so ultimately, yes, the answer is hopefully in the future there will be these people, but in the meantime, it's going to be me and other people like me who are interested in this, who are having conversations, who are educating our physicians, our young physicians in training, our nurses, our young nurses in training, and hopefully empowering them, the new generation, with a whole new concept of caregiving the caregiver.
Yeah, no, it's a quality issue, and I would think even from a management business side that's important.
Yeah.
Retention of your providers, the quality of care that's provided, it runs the gamut. So it's good to hear.
It costs $40,000 to $80,000 to onboard one RN. It can cost up to $250,000 to onboard one physician. And so if you maintain that person in your caregiving body in your institution, then it automatically pays for itself to have this dedicated individual. And my God, if you save one person from taking their life, I mean, you cannot put a value to that.
Yeah.
And so we know that suicide is about twice as prevalent in healthcare providers as it is general population. And so, there's a real problem here, and there are real solutions here, and I don't have them all. And I understand that my idea isn't in its final form; it's only in its infancy. And ultimately, there will be a young person who I hope will take up, the baton and move this forward in time. But yeah, great question. So that brings us to the toolbox. And so this is the most exciting part for me, because this is how you stay healthy. And this is also how you move from being dysfunctional back to functional. And even if you're all the way down to the drain, it's how you can climb your way back from the drain to being completely normal, completely functional, being that bright-eyed medical student, in your first year, or that nursing student who was applying to nursing school hoping to get in, and you just were full of dreams about how the world could be, and you were going to help people and save the world. And you can still help people and save the world, but you got to save yourself first. And so I like to break the toolbox down into 4 parts: the physical part, the mental part, spiritual part, and the emotional part. And so physically, for our bodies, we have to engage in some sort of intentional suffering to help our trauma. If you look at, there's a great book by Robert Sapolsky, I think, called "Why Don't Zebras Get Stress Ulcers?" And he talks about when the zebra's on the plain eating grass, it's not worried about anything at all. And then the lion jumps out and tries to eat the zebra, and it's very alarmed at that point. It goes into its sympathetic nervous system, fight or flight. It is running all over the place, zigzagging. It gets away from the lion, and what does it do? Immediately, it shakes vigorously, takes a big deep breath, and it goes back to eating the grass. It doesn't ruminate about it. It doesn't think about it. It doesn't get mad about the lion. It doesn't get sad that it's the food of the lion. And so that's kind of one of our jobs. And we're highly cognitive creatures. We have great imaginations. I've already told you that I daydream like crazy. So we can daydream about lions all day long. But one of the things that we can do at the end of the day when we get off work is we can go for a walk, or we can engage in some high intensity interval training, or we can play pickleball, or we can, play around the golf, or we can get on the rowing machine. But we need to get our heart rates up a few times a week. If you get your heart rate into zone 2 or 3, that's even better. That intentional suffering from walking 18 holes in the heat, or from running a 5K, or from doing a CrossFit class or something like that, it creates a sympathetic surge inside of our body. And when that sympathetic surge is over and our body feels safe again, we lower back down, our cortisol drops, our parasympathetic nervous system kicks in. We create some endorphins from that workout, and the serotonin and the dopamine from that activity automatically rise up and give us a sense of well-being. So exercise is a must. But then there's other things like massage, acupressure, acupuncture. Breath work is another super easy thing, and we're going to do that here in a second. We're not running too late, so we'll do that. It's really fun and easy and free. A lot of people talk about ice therapy and heat therapy. I don't like ice cold therapy, but getting in a ice cold bathtub, or a polar plunge, or putting even a cold compress on your neck will actually cause you to take big deep breaths. So it ices your vagus nerve, it stimulates the vagus nerve, it makes you suffer a little bit. So you're having to control yourself, you're having to go to your deep breaths, you're having to modulate your sympathetic nervous system. So it's forcing you to be a bioengineer of yourself. And what happens is, whenever you get into a big situation where you have a sympathetic surge because of a difficult patient or a difficult family member or a really scary situation, you will feel that sympathetic surge, and you'll feel the same surge that you get when you get in the ice bath, or you get in the cold shower, or you've been in the hot sauna for 20 minutes and you feel like you're going to die. And you can kind of breathe yourself out of it. So it kind of forces you to do breath work. It forces you to modulate your sympathetic nervous system, and teach you to modulate your sympathetic nervous system. So ice therapy and heat therapy are really good. Sleep is another one that's absolutely important. If you don't know about sleep hygiene, do some research on sleep hygiene. If you need earplugs, get earplugs. If you need a mask, get a mask. I have both those things. And some days I come home and I throw on my earplugs and mask and I take a nap before I go work out. If you are having issues where you're tired all the time, get a sleep study. A lot of us have OSA, and there's no shame in that. There's no shame in checking that out, making sure that you've got good, high quality sleep. A wearable like a Apple Watch or Garmin or a Whoop band to look at your sleep is super useful and helpful to get your metrics on how deep are you sleeping, the core sleep, the REM sleep. Another physical thing, my funnest physical thing, is sex. Like, you need to engage in sex. Sex causes a massive explosion of dopamine and serotonin into your brain, increases your sense of well-being. It's just very important for us to have a healthy sex life if we can. That's another physical attribute. But exercise, and sex is also part of exercise too. But it metabolizes trauma, and it helps you masticate and chew that trauma up. And then once you've metabolized it, masticated it, it just excretes itself. Mental traditional psychotherapy is great. Counseling is great. Psychologists are great. Psychiatrists are great. Cognitive behavioral therapy is a fantastic technique. If you don't know cognitive behavioral therapy, it's basically conversational therapy where a trained practitioner engages you about your core beliefs and your false beliefs, your limiting beliefs, and sort of acts like a mirror using the language that you articulate to the individual. And it helps you see your thoughts and see your beliefs. And maybe you've never been able to see those things. And so it helps you become naked to yourself. And then that practitioner can help you with cognitive reframing so that you look at a situation from all these different POVs until you find a more beneficial POV that helps, that serves you. Internal family systems therapy is another fantastic modality. Internal family systems therapy says that we have all these different aspects of us that are constantly at play. And sometimes it's a manager who steps in, or it's a firefighter who's trying to save us from some aspect or part of ourselves. So internal family systems therapists can be super helpful and beneficial. Hypnosis and hypnotherapy. Using mantras. I'm a big mantra person. Mantras are just engaging neural networks in our brain. And one of mine is like, I'm safe, I'm happy, I'm calm, I'm safe, I'm happy, I'm calm. So if I ever am in a situation like a difficult case, I'm using that. If I'm trying to go to sleep at night, I say deep restorative sleep, deep restorative sleep. It's typically 2 to 3 to 5 words, short and pithy, but you're just driving traffic through neural networks that are going to be beneficial to you instead of not beneficial. So positive self-talk, hyping yourself up, engaging in hobbies, anything that takes your mind away from your day, takes your mind away from your trauma, takes your mind away from your schedule that you've got tomorrow. So whether that's RC cars, or whether that's a needlepoint, or if that's stand-up paddleboarding, or hiking or mountain biking, or whatever. Hobbies are fantastic. Art, like behind me, engaging in pottery. All those things are fantastic. And mental also is having boundaries, having professional boundaries where you're not afraid to tell somebody, I don't have any more to give you. Like, I can't work this weekend. I can't cover your shift because I'm overextended. I've been having some issues with, I think, burnout, or I'm very depleted. I might be suffering from some compassion fatigue, and I need to be off this weekend to take care of me. And so having healthy boundaries is another important thing. And I'll hopefully be talking about that October the 25th at our meeting, boundaries and boundary setting. Spiritual, this is one that we don't talk a lot about in medicine. It's like love. We don't talk a lot about love. We use words like unconditional positive regard for our colleagues, or unconditional positive regard for our patients. It's love. But spiritual prayer is very helpful to a lot of people. Meditation, which I teach meditation and breath work and Heal Our Healers. And we can do that at a later date, but I would love to talk about meditation. Qigong is a 5,000-year-old system from China, and it's just energy manipulation in your body. We have energetic centers in our body, and Tai Chi is a martial art you guys probably have heard about that grew out of Qigong. Reiki therapy, forest bathing, which is one of my favorites, and just going out into the forest and engaging with nature, touching nature, looking at the trees, listening to the birds, decreases cortisol level. It increases natural killer cells in our body that help our immune system. And then there's ketamine therapy, which I put that under spiritual because it creates these altered mental states that are very ineffable. They're undescribable, but we're having tremendous results with patients with PTSD, and severe medication-resistant and electroconvulsive therapy treatment resistant depression who are getting better with ketamine therapy. and suicidal ideation who are getting better with ketamine therapy. And ketamine therapy, typically you go to a clinic, a physician or a PA or an NP or a nurse anesthetist starts an IV. They run a 0.5 to 0.75 milligram per kilogram ketamine infusion for an hour. Some places have therapists there. Some places you can bring your therapist or bring your clergy. Some places have therapy animals that you can pet as you receive your ketamine therapy. Ketamine therapy is phenomenal because it causes increased levels of BDNF, brain-derived neurotrophic factor. It's a big word for miracle growth for your neurons. So neurons that are sad don't talk to each other, just like people who are sad don't talk to each other. They're disconnected. But neurons that have these little rootlets called dendrites are happier neurons, and they communicate better, and the networks work better. And so ketamine has been shown to increase BDNF. BDNF causes dendritic growth or arborization. And these neurons that have good arborization and good communication are happier neurons. And so these people get better. It's also a dissociative anesthetic. So it helps separate your emotions from the event. So if your ego has been holding a traumatic event away from you because it has so much powerful emotion attached to it, ketamine can help break that connection and help you see that trauma from a more rational or a new perspective, and help you kind of recontextualize it and understand that you're safe. Even though that thing occurred and happened to you, it doesn't define you, and it's not the end of you. And so people can get better from that. And then support groups, whether it's a prayer circle or whether that's a Alcoholics Anonymous group, or whether that's just three ladies in the break room debriefing with each other. That connection that you get from being with other people is absolutely phenomenal on a spiritual and emotional perspective. And that brings us to emotional. Emotional things like singing can help you engage and take your mind away from your traumas and activities, and help you engage with emotions that you don't feel safe expressing. But you can sing a sad song, and that can help you metabolize some of the sadness. You can sing a happy song. You can sing, whatever. Acting and being involved in community theater or church theater or whatever, that actually is a great way for you to express emotions that have been locked inside. It's a great way for you to adopt a alternate point of view because you're playing a character that looks at things differently, and kind of can help teach your subconscious to view some of your traumas from different perspectives. It is so creative that it opens up a latitude of options and abilities. And ultimately, we're talking about neural networks in your brain. It opens up these neural networks in your brain that allows you to recontextualize your trauma. EMDR is a peer-reviewed by the ASA, and it's eye movement desensitization, reprogramming. And a lady was traumatized, and she was watching her child on a swing, the lady who discovered this. And she realized that her trauma abated when she was watching the child on her child on the swing. So she started doing research into this, and she came up with a whole therapeutic process where you talk about the traumatic event that occurred while you're watching a pendulum or watching a dot move back and forth on a screen. And there's auditory cues they can also do. And somehow this rapid switching and the eye motion and the processing in your brain helps you engage with that trauma and recontextualize that trauma. So EMDR is an emotional I think it's an emotional therapy. And there's EFT, and EFT is emotional freedom technique, and it's tapping. And you just use acupressure points on your head, on your eye, on your mouth, on your chin, on your clavicles, on your arm, and on your wrist. And you tap, and as you tap, you talk about the trauma. So you acknowledge the thing that happened to you that was really sad, really bad, really hard, really painful. But you also talk about it in a way that's open, that you accept yourself, you accept this situation occurred, that even though this situation occurred, you're safe and you're open to the idea of feeling better. And then as you tap and you talk, you begin to create a space for potential healing to occur, and your subconscious will ultimately allow these things to occur. That's not quite peer reviewed yet. The jury is still out, but the people who do tapping and EFT swear by it. And if it saves somebody and the people are getting better, I kind of think the proof's in the pudding. And so even though it might sound like pseudoscience, if putting a crystal under the moonlight charges that crystal up, and then you holding that crystal on your chest makes you feel more safe and more loved and more healed, then I say go with that. That's okay too, because a lot of these things that we're talking about are, they have a placebo effect. There's a portion of the placebo that is real. There's studies that show even if you tell somebody they're receiving a placebo, 20% of those people are going to get better. Even when you tell them they're receiving a sugar, this is a sugar pill, it won't do anything to cure you, these people still get better. And so that just speaks to the innate power of us to heal ourselves. Sometimes we just don't have the confidence to do that naturally. And so we need a crutch, we need a ritual, we need a totem, and that's okay. So that's the toolbox. And if everybody's okay with it, I will finish up with our next exercise. And this exercise is just a way for us to really quickly hack our inner landscape. And so if you find yourself in a situation where you're in your sympathetic nervous system, you're either sympathetic or parasympathetic, fight or flight or freeze or rest, digest, and repair. And our goal is always to be rest, digest, and repair, because that's where your agency is. When you're in a fight or flight or freeze, there isn't a whole lot of agency. We're just trying to get away from the bear, get away from the attacker, fight off the rabid dog. And so if you're in surgery, that's not a really great way to be. If you're in the unit and you have somebody decompensating, you don't want to be fight or flight or freeze. You want to be rest, digest, and repair. And so the way that we can do that is we can go to our breath. And so I'm going to invite you guys to sit up tall. I'm going to invite you again just to notice your breath. So just for a second, we're just going to notice ourselves breathing. And just give your body some gratitude for always breathing for you. You never have to make your body breathe. It always breathes for you. You can go to sleep and your body breathes. And just take a moment to notice and marvel at how amazing and how beautiful this process is. And just have gratitude for the magic of the breath. Now I'm going to ask you and invite you to breathe through your nose. When you breathe through your nose, you humidify the oxygen, you warm it, and you actually absorb about 25% more oxygen into your bloodstream. So you're hyperoxygenating your blood right now. Automatically, you're feeling better because you're giving your blood more oxygen, your tissues more oxygen. Now I'm going to ask you to soften your jaw, open your throat, let the oxygen go deep into the lungs. And I'm going to invite you to put your hands right above your hips on the sides of your belly. And as you breathe in, I want you to feel the sides of your belly go out. So you have to use a big belly breath to do this. Kind of like you got your hands on your hips, but a little bit higher. Feel that belly get really big as you breathe. Breathe in through your nose and out through your mouth. Now we want to think about an ice cream cone. Ice cream cone's pointed at the bottom, it's a big round on the top. So we're going to take a breath as we breathe in. We're going to breathe up the side of the ice cream cone. Then we're going to breathe on top of it. That's the little scoop of ice cream. Then we're going to breathe out. Breathe out. Good job. That's called the physiological double sigh. That's the quickest way to get your parasympathetic nervous system. Breathe up the side of the cone. That scoop of ice cream on top. Breath. Breathe out. Stay with that abdominal breath. All right, ice cream cone is yummy. So we're going to hum. So we're going to take a deep breath in. We're going to breathe on top of it. And we're going to hum. Take a deep breath in. Breathe on top of it. Breathe out, hum. Let it sink all the way down to your chest. Deep breath in. Breathe on top of it. Breathe out, hum. So what we're doing is we're stretching our abdominal viscera. We're stretching the vagus nerve. Keep breathing on top of it. We're letting our diaphragm descend as our belly moves outwards into our hands. And by stretching the vagus nerve, it's sending afferent signals up to our brain to rest and digest. The hum is just vibrational frequency around the vagus nerve. The vagus nerve goes down from our brain, through our throat, through our chest, and spreads out over the abdominal contents like roots of a tree. And by that big hum, you're just humming in your belly, humming in your chest, causing more stimulation, more vibration of that vagus nerve. And you can relax, open your eyes. You should feel kind of light. You should feel sort of relaxed. You should feel sort of kind of high. We just caused serotonin, dopamine, oxytocin, and endorphins to be released in our body. We literally got high off our own supply. I promise you, if you find yourself in a stressful situation, whether it be a fender bender, whether it be a fight with your spouse or one of your teenagers, I've got 4 here, do that, and immediately it will move you from fight or flight to rest and digest. It'll give you a little more agency in your life. It will help free you so that you have the ability to make decisions more clearly. And the last thing I want to leave you guys with is that if you feel like it's too late, if you feel like that you're all the way down the drain, I promise you it is never, ever too late. As long as you're taking a breath, you're salvageable. You're not broken. You're just not done yet. We just got some work to do. Reach out to me at Heal Our Healers. Join our Facebook group. Send me a DM. But most importantly, if you don't feel like doing any of those things, you can text 741-741. Text TALK to 741-741. And there's a national hotline. There's trained people there. I actually did this. I texted TALK to 741-741, and they texted me back and asked what I wanted to talk about. Then I asked, "Are you a bot?" And they said, "No, I'm not a bot." And I said, "That's what a bot would say." And she goes, "I promise I'm not a bot." And I was like, "So tell me your education." So she told me her training and education, her name, and I told her what I was doing and why I was checking it out. And she assured me she was a real human being who actually cared about me. And that was very nice. And then if you are contemplating self-harm or suicide, please dial 988. 988 is the suicide hotline. If you don't feel like talking to anybody in the world, just give it one more shot and dial 988 and talk to that person. And then if you don't feel like doing any of that, you don't feel like you can trust anybody, there's a new empathetic chat bot that's been released called Hume.ai, Hume.ai. And it says it's a pretty good chat bot. And I've tested it for hours. And I've talked to it about compassion fatigue, burnout, PTSD, PTSR, moral injury, vicarious trauma. And it gives really good feedback and really good advice. And it ultimately, I think it may even take the place of a lot of professional counseling. But I'm so grateful and thankful that you guys asked me to speak. I'm so thankful that you guys found that this is important and have given me this opportunity. I'm so grateful.
Absolutely. Thank you very much for your time and your presentation and advice. And thank everyone else for joining us tonight. We will do another Smart Round next month.